Hi and Assalamualaikum. Today my group will present about ultrasounds. For introduction, what is ultrasounds? Basically, a straightforward explanation of a wave that transfers mechanical energy via the local vibration of particles of frequency of 20 kHz or higher without including any net movement of the particles themselves can be completely inaccurate or misleading.
Hi, my name is Nurin. I will explain about explanation of relevant to scientific instrumentation and application concept. Firstly, instrumentation and components. An ultrasound machine consists of several key components. Firstly is transducer, a probe that generates ultrasound waves and detects reflected echoes. It uses piezoelectric materials that vibrate due to echo pulses from the tissue. Amplifier increases the size of electrical pulses coming from the transducer after an echo is received. Thirdly is pulse controls. Dials and control used to adjust the amplitude, frequency and duration of ultrasound pulses. Fourthly, central processing unit processes signals from and to the transducer, converting them into an image from. Display, a screen that shows image from the ultrasound scans. Printer prints image from the display data. And lastly, storage device, a digital device that stores image for later use. Secondly, modes of ultrasound. There are several modes of ultrasound used in medical imaging. A mode, the simplest type where a single transducer scans a line through the body and echoes are plotted on screen as a function of depth. B mode uses grayscale processing to create detailed image of internal structures. A mode used for real-time imaging where the transducer is moved mechanically or electronically to sweep the beam. And lastly, 3D imaging acquires a series of adjacent 2D image to generate a 3D representation of the body. Lastly, the applications. These are few applications that I would tell you. Firstly is echolocation, used by animals like bats to navigate and locate prey in the dark. Secondly, sonar, used for navigation, detection, and communication underwater. Thirdly, lithotripsy, break stones in the kidney using high-energy sound wave. And lastly, echocardiography, forms image of the heart using reflection and detection of ultrasound waves.
Next, for detailed exploration of ultrasounds, this exploration will cover the principle of ultrasounds, its generation and detection, application and safety considerations. Here are principle of ultrasound, which sound wave and frequency, propagation, and lastly is reflection, refractions and absorptions. Second is generation and detection of ultrasound, which transducer and pulse echo method. Thirdly is application of ultrasound, medical application and industrial application. Lastly is safety consideration for bioeffects, regulation and standard, and usage guidelines. For principles of ultrasounds, sound waves are mechanical vibrations traveling through a medium with frequency ranging from 20 kHz to several gigahertz. Ultrasound wave with speed varying depending on the medium's properties can be reflected, refracted, and absorbed. The speed of ultrasound in air is 343 minutes per second, but higher in liquids and solids. Reflection is used in imaging techniques, while absorption is used for therapeutic purposes. Okay, second, for generation and detection of ultrasounds, basically, ultrasound waves are generated and detected using transducer such as a piezoelectric transducer, which convert electrical energy into sound wave and vice versa. The pulse echo method is commonly used in medical and industrial imaging, where short bursts of ultrasounds are emitted and echoes are detected and analyzed. Thirdly, for application of ultrasounds in medical applications, ultrasound imaging including sonography, echocardiography, Doppler ultrasounds, and physiotherapy is used to visualize internal organs, monitor pregnancies, and guide biopsies. It also aids in evaluating heart structures, blood flow, and detecting abnormalities in blood vessels. For industrial applications, non-destructive testing (NDT) inspect materials without damage, used in aerospace, automotive, and construct industries. Ultrasonic cleaner clean delicate items, and welding and processing joint materials using high frequency vibrations used in food processing and sonochemistry. Lastly, for safety considerations, ultrasound is generally safe, but high-intensity exposure can cause tissue damage. Regulatory bodies like FDA and IEC set safety standards for ultrasound equipment. In medical diagnostic, the ALARA principle is followed to minimize exposure using the lowest settings possible to achieve necessary diagnostic information.
Next, we move to example of real-world implementation of ultrasound. We have a cleaning, which is ultrasonic cleaning is utilized on things with difficult to reach portion, such as spiral tubes and electronic components. Number 2, ultrasound can use for detection of crack, which is ultrasound can identify flaws in metallic components using in the construction of high-risk construction like building and bridge. And for navigation, ultrasound have a sonar, which is sound navigation and ranging. It's a technology that use sound wave to navigate, detect, and communicate beneath the water surface. And lastly, ultrasound can use for medical, which is fetal ultrasound scan, assess the health of internal organs, and treat joint pain, tumors, and kidney stone. Okay, next we talk about potential benefit, which is first benefit of ultrasound is safety, because ultrasound have a no ionization radiation, which is the primary advantage of ultrasound imaging is that images are produced using ultrasonic sound wave. Secondly is a non-invasive approach, which is ultrasound exam do not require invasive procedure. And then number 3 is an excellent alternative to MRI for claustrophobic patient, which is MRI scans can be very loud and jarring. The confined space in the machine can be too much for claustrophobic patient. And then for number 4 is accessibility and speed, which is ultrasonography appointments are usually brief, lasting no more than a few minutes. And then ultrasound can show soft tissue in great detail because of ultrasonography is ideal of visualizing soft tissue. And then ultrasound is painless because ultimately they are not in need of needles, incision or injection. Okay, so patients are thereby spared from a long-term chronic pain following surgery or surgical complication. It lastly is relatively inexpensive. So ultrasound procedures are also less expensive than other diagnostic imaging examination, which is making them accessible to a wide range of patients. We move to the challenge of ultrasounds. First is skill requirement. The operator's competence and experience have a major impact on the quality of the ultrasound image and the interpretation correctness. Number two is training, because healthcare professionals must receive a proper training and ongoing education in order to stay proficient. Number three is a depth limitation, which is limiting the use of the imaging organs like the lungs and intestine are located deep within the body or they are surrounded by gas. And number four is a body habitus, which is patients who are obese or have a lot of muscular mass may have a problem because worse image quality, because more tissue must be penetrated by sound wave. And then lastly is resolution contrast. For some application, ultrasound may not have as high of spatial resolution as CT or MRI, even though it is still useful for soft tissue imaging.
My name is Nirana Jaini. So this is a future development of ultrasound. The first one is enhanced image quality. Advancement in ultrasound transducer design and signal processing techniques will lead to higher image resolution, improvement contrast, and better tissue characterization. This will enable more accurate diagnosis and the ability to detect subtle abnormalities. And the second one is holography and virtual reality imaging. Holography and virtual reality based ultrasound imaging could revolutionize medical education and training. Medical professionals could immerse themselves in 3D ultrasound image, enhancing their understanding of anatomy and pathology. This is an innovation of ultrasound. The first one is artificial intelligence AI and machine learning. AI and machine learning have been increasingly integrated into various medical applications, including medical imaging, diagnosis, personalized treatment planning, and drug discovery. AI algorithms are being used to analyze large datasets, aiding in faster and more accurate diagnosis, as well as predicting patient outcome. And the second one is telemedicine and remote patient monitoring. The COVID-19 pandemic accelerated the adoption of telemedicine and remote patient monitoring technologies. Virtual consultation, remote monitoring of vital signs, and digital health platforms are becoming more prevalent, providing patients with convenient access of healthcare service. So, the conclusion summarizing key takeaways of ultrasound. Diagnostic ultrasound is a powerful, minimally invasive tool that improves the diagnostic accuracy of clinical examination when employed at the bedside. Understanding ultrasound physics is critical to image acquisition, image optimization, image interpretation, and ultimately clinical integration. Once aware of ultrasound principles and how machines use them to manipulate sound waves, sonographers can best utilize the available tools to optimize the clinical utility of diagnostic ultrasound.
Just trust me, you'll be fine. And when I'm back in Chicago